Hi, everybody. I think Amy, we're all good now. Thank you. Sorry, we had a little bit of a glitch on the back end, but thank everyone for joining us today and coming to this important webinar. I think it's a great topic, and I'm hoping to learn a lot more about this as well. So I'm Dr. Nicole Simone. I'm a radiation oncologist at the Sidney Kimmel Comprehensive Cancer Center. I'm a radiation oncologist by training and do bench to bedside research, and I've gotten into doing some community outreach, and I've learned how important it is to have community advocates as part of the voice of our trainees, as our research partners. And I'd love to just share a little bit more with you today. We have an amazing panel, and I'm going to introduce the speakers one by one. So Dr. Amy Leader is a professor in the Division of Population Science and the Department of Medical Oncology at Thomas Jefferson University. She has a secondary appointment in the College of Population Health, where she teaches courses in the Masters of Public Health program. She's the Associate Director of Community Outreach and Engagement at the Sidney Kimmel Comprehensive Cancer Center at Jefferson. And in this role, she leads our Office of Community Outreach and Engagement to ensure a meaningful bi-directional relationship between the Cancer Center and the community that it serves. Dr. Jinsoon Bitar is an assistant professor of medicine and breast medical oncologist. She joined the Samuel Ocean Comprehensive Cancer Center at Cedars-Sinai in Los Angeles after completing her fellowship in medical oncology at the City of Hope. She also holds an appointment in the health sciences in the clinical as a clinical assistant professor at the David Geffen School of Medicine at UCLA. Her primary research focus lies in personalized treatment for breast cancer, with a particular interest in exploring cancer genomics in diverse groups and immigrant populations of Los Angeles, particularly in the Asian American community. And she's going to talk to you today about one of the projects that she's doing. And finally, the star of the show is going to be Dr. Silvia Byer. She's an active member of the Pivot Masonic Cancer Alliance program. She's a former patient and a clinical trial participant. She's deeply committed to patient advocacy, and her involvement with the MCA was actually driven by her personal journey of recovery and survivorship following a diagnosis of triple-negative breast cancer, and an outcome made possible by the life-saving treatment that she received, including her enrollment in the clinical trial for Keytruda. She appreciates the opportunity to contribute her perspective on integrating community outreach and engagement. She's very active at her cancer center and into research, and to collaborate with all of her fellow panelists. So thank you all for joining today. I know we're a little behind time, so I'd love to introduce Dr. Leader first, who's going to give a brief presentation. Thank you, Dr. Leader.
Thank you, Dr. Simone. Hi, everyone. I believe our AACI slides are up. Are you all seeing slides? There we go. There we go. Okay. Hi, everyone. I'm going to give a very short background on why this is important, why we should be engaging community members in our cancer research activities, such that we can then turn it over to our other panelists to hear examples of engagement in community and research, and also to hear from our patient perspective as well. So let me set the tone here. And I think Haley has our slides. So next slide, please. And let's start with the idea around trust and understanding of science, which is having a little bit of a problem lately these days, but I want to set the stage for us. Next slide, please. So there's been data that comes out every few years from the Pew Research Center that gives a snapshot of the American public understanding, confidence in scientists, and generally how we're doing in this world. And so the one on the left here, confidence in science is slightly up since the pandemic, but it is lower than the pandemic. So if you look at this, there's about 3/4 or so who have confidence in us, but there's still about a group, about 25% of the general public, that doesn't have a lot of confidence in scientists and researchers. And that's a little problematic. And then if you look at the one on the right here, scientists are widely seen as intelligent, good for us, but fewer than half of the public sees us as good communicators. And that is also problematic because we have the job of communicating science. Next slide, please. And so when we start to think a little bit more deeply about the public understanding of science, this complicated world of science that we live in, and we try and communicate with the public, there were some questions that had been asked about what Americans know and don't know about science. And you can sort of look down the list at the percentage of scientists who, the percentage of the general public who might understand things about gene science or some earth and physical science. But if you look down towards the very bottom around scientific processes, only about half of the general public understands maybe what a hypothesis is, which is kind of central to cancer research, randomized controlled trials, and things. And so if you think about that, maybe only half the public truly kind of understands what we're doing. I think a lot of times we're literally talking about apples, and the public might really think we're thinking about oranges. And so next slide, please. And so I always share this little slide here too, because 32%, about a third of the general public still believes their lives wouldn't be very different if science didn't exist. And so that also is problematic. So there is really this idea that we're not doing a great job of communicating science to the public and engaging science community members in the work that we do. Next slide, please. And then you add in the rise of scientific misinformation and to really cloudy the water. And this is just a graph here about research that has been published about misinformation. This isn't even the volume or frequency of misinformation itself, but just the sheer research on the topic of misinformation is just continues to skyrocket during and after the pandemic. So you add in misinformation to this, and it really becomes complicated. Next slide, please. But luckily, we do have some trust in information sources here. So we have high levels of trust around doctors, healthcare professionals, and others. So this is good. So we're largely seen as trustful. And next slide, please. I want to make sure we keep going. And so if we put all of these things together, the sense that we have complicated information to share with others, we're seen as intelligent, we're seen as trustworthy, but we're seen as not great communicators, we wonder, how can we do this better? And so for a very long time, there have been patient advocates in the world, and you may know of them, and they may be your navigators or patient advocates at your cancer center. They're helping to guide our patients through this complicated healthcare system that they're scheduling appointments and going to infusion and making decisions about their treatments and whether to join trials. Those are all the things that patient advocates do. But more recently, there have been things called research advocates, and we'll hear from Silvia here today, who's serving in a research advocate role, where they're serving as this link between patients and scientific researchers. They really are helping us communicate science to patients. They're helping patients understand clinical trials and the reasons they may want to join a clinical trial or to ask questions about clinical trials. They bring patient perspective into our research, which is so valuable. And they help us disseminate information. So you're going to hear today more about this idea of a research advocate. Next slide, please. The work that you're going to see is novel and important and creative, but it's also not entirely new. There's a growing evidence base of research advocate programs. You're going to hear from the University of Kansas's program today, the Pivot program, but there are others. PCORI is a huge proponent of research advocates in their work. The AACR runs their Scientists to Survivor program. My own cancer center, we developed the CLEAR program. Moffitt has programs. There may be a program at your cancer center as well. So if there's not, I encourage you to go back to your directors and others and ask about something like this, but there is an evidence base which we can draw from. And next slide, please. And so research advocates today, you'll hear from Silvia, who's serving in potentially multiple different roles here, but they kind of run a spectrum here from merely just informing the investigative team of things that they might be able to help with and how we can share our protocols with our patients and communities, and they can inform some of that work, consultation into collaboration, but then all the way up into what would be considered maybe even a gold standard of community and patient engagement and research, where they're actively directing some of the ideas behind the research, the way data is collected, the way data is interpretive, really starting to help generate that research alongside of an investigative team. So it really does kind of run the spectrum of how patients can be involved in research. And I believe I have one more slide. Next slide, please. And just to kind of wrap up here, some of the impact of a research advocate. Of course, we've been talking just very briefly about the contributions they can bring to things like the research feasibility and what we can expect patients and community members to be able to do or not do in their research. But it can also increase the quality. We can think about the ways that investigators are creating protocols that patients want to be involved in. There's skill building from the patient side as well as the investigator side. That skill building goes both ways. Patients and community members can be involved in disseminating the findings in lay language back to their communities through their own channels. And ultimately, we're designing more patient and community-centric research and clinical trials. So I believe that's my last slide. And I believe I'm going to pass this back to Dr. Simone, who's going to pass it over to Dr. Bitar. Thank you.
Great. Thank you so much, Amy. So next up is Dr. Bitar, who I already introduced, but she's going to tell us about a real example of some work that she's done with community partners and how impactful that's been. So Dr. Bitar?
Thank you, Dr. Simone. Hello, everyone. My name is Bitar, and I'm a breast medical oncologist at Cedars-Sinai Medical Center. Today, I'm going to talk about a collaboration between COE and Cancer Research Program at Cedars-Sinai. This has been working on improving clinical trial awareness and increasing trial enrollment among Korean immigrants in LA. Next slide. This is my disclosure. Next slide. So why Korean immigrants in LA? The first map shows the distributions of racial and ethnic communities in LA. As you may know, LA has a large Asian population. You see these green dots in the next map, which is Koreatown in LA. Koreans are one of the largest Asian population in LA, and LA County has the largest Korean community outside of their home country, South Korea. And Cedars-Sinai is located very close to Koreatown. Therefore, Korean community is one of the biggest catchment areas of Cedars-Sinai. Next slide. At the neighborhood level, this map on the left side shows late-stage breast cancer diagnosis across LA County. The heat map highlights Koreatown as a significant hotspots with a very red color in the center in the first picture. The next picture in the middle side shows free or low-cost mammogram clinics with purple dots, which are widely available in LA. This means many underserved women can get free breast cancer screening mammograms. However, screening rate remains low. To address these barriers, we launched a health and faith initiative in partnership with the Korean churches, where we identified a large congregation of over 100 churches represented by the blue dots on the third map. This community-driven approach helped us build trust and increase awareness, ultimately leading to research, navigation, and clinical trial participation, which I will introduce on the next slides. Next slide. So our community outreach engagement conducted a survey in Koreatown to assess barriers to cancer prevention, treatment, and clinical trial participations. Through the Cancer and Healthcare in LA survey, we found that 52% of Korean women did not receive screening mammograms. And several key barriers contribute to low screening rates in Korean community, including language barriers and a lack of trust of a health system. Next slide. COE integrated my work and me into this community network designed to support education and research participation, which aligns with my goal of improving clinical trial access. This network include federal qualified health clinics, faith-based organizations, breast cancer survivor group, the community advisory board on the right side of the slides, as well as Cedars-Sinai researchers and physicians on the left side. Additionally, within the Cancer Clinical Trials Office, we have a dedicated navigator working to address any barriers to participation in clinical trials. Next. We established the Health and Faith Initiative in Korean community, recognizing that regular attendance at churches and faith-based venues provides a valuable opportunity for education and behavior change within the community. Through this initiative, we connected community members to screening and support service with the help of trained navigators, fostering both access to care and community trust. You can see many photos here. So we are active throughout all Korean communities, including churches, community clinics, and a local college. Next slide. All of these efforts led to the Faith in Action study, which was funded by the California Breast Cancer Research Program and improved the breast cancer awareness and care within the Korean community in collaboration with the local Korean churches. Our COE trained 45 navigators in 24 churches and identified over 230 women who are not compliant with the breast cancer screening program. Through this effort of COE and this study, the compliance rate increased to 55%. Next slide. COE also launched a health navigation training program to expand and improve access to cancer education, screening, and research participation. This program provides the skills needed to support community members throughout their cancer care journey. Next slide. These are our own COE navigators who support both community members and community navigators throughout cancer care with a focus of diagnosis, treatment, and reducing barriers to care. The MJ Sung in the third photo, one of our navigators, speaks Korean, helping to bridge language and cultural gaps in the Korean community. Next slide. With this infrastructure in place to engage breast cancer survivors, community leaders, and faith-based groups, I can deliver critical information about clinical trials to Korean community using Be Part of the Cure clinical trials awareness campaign developed by Cedars-Sinai COE. This allows me to address common concerns such as the safety of clinical trials, by explaining key concepts like randomization, a new investigational agent, and access to standard treatment. Next slide. I also deliver my message to Korean churches with the support of COE, which coordinate with the church leaders, community clinics, and navigators. So I have this type of seminars, lecture at least twice a year in Korean community. Next slide. Our CEO and physicians are also able to share our message with the Korean media, reaching thousands of people in LA, particularly in Korean community. Next slide. Through all our efforts, we have significantly improved positive perceptions of clinical trials by 32% and increased willingness to participate in trial by 17%. Next slide. Here are some of the voices from Korean communities with the translation. People have learned how important clinical trials are and now have a more positive perspective on clinical trials. Next slide. Through this large-scale intervention, we developed a pathway, tested it, and it works. We started with community outreach and education. Then patients are connected to COE navigators to identify specific needs. COE navigators provide general information about clinical trials and connect them to clinical trial navigator, where the patient is referred to the physicians conducting clinical trials. Next slide. Our COE ensures a warm handoff of cancer clinical trials office and physicians, providing comprehensive support for all by using navigations as a key support tool. As a result, 4 individuals from the Korean community inquired about clinical trial participation and 2 were enrolled in clinical trials. Next one. So lastly, we are now involved in survivorship program. I'm developing a peer support survivorship platform with a COE in our catchment area. We will secure the internal pilot funding from Cedars-Sinai to test and further develop the study. So our goal is to educate survivors about clinical trials and bring these trials to all the patients in our communities. Next one. Yeah, that's it. Thank you.
That was wonderful, Dr. Bitar. And for those of you who are on the call, feel free to put your questions in the chat and we'll get to them right after we have our last speaker. So Dr. Byer, thank you again for joining us today and really bringing the patient voice. So we've heard from Dr. Leader about the overall goal of community advocacy and working bidirectionally to perform research. Dr. Bitar gave us a real example of that interface and how that works. And then we can't wait to hear from Dr. Byer about her experience as being an advocate and helping partner and bridge those gaps. So Dr. Byer, thank you for joining us today.
Thank you so much for having me. Hello, my name is Silvia Byer, and I'm here to represent those patient voices. In fact, I am a member of Pivot at the University of Kansas Cancer Center, and it is a program that acronym stands for Patients and Investigators Voices Organizing Together. So I'll be illustrating how patients can become patients research advocates. This is a volunteer position, and I'm also part of their leadership and educational task force. I am a language and linguistics professor at Park University, and as that, language is essential. It seems like it's echoing everywhere, especially in this presentations, in this webinar. It is essential for dissemination of information. So the language, I believe, it's a central element of power, and clarity of language strengthens the appropriate sharing of power. So to that end, physicians, researchers, as you are often called to utilize cultural humility, which was formerly called cultural competence. It was changed to humility, I don't know if you know that, because we cannot be competent in all cultures. And cultural humility also means to understand the culture of your patient, kind of like Dr. Bitar just mentioned, right? So next slide. We as patients are bombarded on social media with information we cannot decipher. And as here my fellow presenter, Dr. Leader, just illustrated, we patients ask doctors, ask the scientists for reassurance and truth, because we're bombarded completely in social media and we don't know what to believe, right? Where's the truth? But during these exchanges, we face potential barriers because we don't understand the terminology. And as a linguist, I studied the mechanisms of language and how language is perceived in different contexts. So this precisely aligns with the mission of these efforts, that the community outreach and engagement between researchers and patient advocates and patient research advocates. So Pivot is a program that seeks to connect researchers with former patients for an interchange, to create a synergy between the investigators and those who have received some type of cancer treatment. So to make the complex information more accessible, clarifying the complexity. So for this reason, actually, I think I've coined the term just now for linguistic humility. So instead of linguistic competence, we cannot be competent in every language and linguistics. So mirroring the cultural humility, we work together to make language more accessible. So how do we build advocate research relationships? This is crucial. I have lived the experience, and it has to be some cancer survivor or co-survivor or pre-vivor. Their experience better inform the research decision-making process by providing the unique and valuable perspectives on what it's like in real life to be a cancer survivor or a co-survivor. so those perspectives can be heard. Advocates contribute to research process by offering valuable patient perspectives from planning to dissemination on clinical trials, patient care, and the complex burdens that patients face. Next slide, please. How can patients advocates be effectively involved in your research? That's kind of the question that I would like to share. So researchers and advocates should develop a mutually beneficial relationship. This allows researchers to educate advocates about their project, while the advocates educate researchers about patients' concerns and experiences. Advocates can review early drafts of your work and can provide regular input about the project. And as advocates learn more about the research projects, they may identify additional ways to assist. And research and advocates should communicate regularly in whatever works best for researchers and advocates, of course. Next slide. So what are the roles that can a research advocate fill on a grant project? Advocates can have a wide range of skills and experience, and of course, knowledge, first-hand knowledge in their story. So advocates may have specific suggestions on how they can contribute to a project. They can work with the research team to develop and review a lay abstract and provide feedback on projects impacting, the patients by identifying the translation potential of the research and how meaningful this is to the outcomes for the patients. So work with the researchers to develop and review your applications as well. Next slide. So what are the guidelines for involvement in a clinical trial? So other portions of the applications can be assuring terminology is understandable to a general non-scientific audience, and then to convey the project's potential overall impact on cancer research and patients' outcome. For instance, a point of confusion that happens to me can be the simple definition of triple-negative breast cancer. So people outside the medical field know that if you are negative, it means that you don't have, for instance, you don't have strep. If you're negative, you don't have COVID. So negative means you don't have it. Well, so as medical professionals, instead, you all know that triple negative is a very aggressive form of cancer. So the confusion here is pretty obvious, right? So I'm not going to comment anymore, but this is where we're at. So advocates then help define their role in the project's implementation, in their annual reporting, and in articulating the impact of the research findings. So work with the researchers as advocates to develop plain language summaries, highlighting the project's potential impact on patients. We can be a community ambassador, speaking about research and the potential significance to patients. Be involved in public speaking engagements, provide the opportunity for advocates and researchers to co-present, and assist researchers in connecting with their cancer advocacy organization and broader cancer community and elected officials as well to change some policies. Work with researchers to create educational material, events, webinars, teleconference for local, regional, and national groups and organizations to inform them about the research and the importance of cancer patients. Last slide. So what are the possible roles of advocates in clinical projects involved in these clinical trials? So work with the project team to design and develop the clinical trial and identify potential barriers for accrual or retention, including but not limited to eligibility criteria. Help develop patient-focused educational material. For instance, co-author brochures to give a short, easy-to-understand description of the clinical trial. This will ensure that the trial protocols are patient-centered, review the clinical trial's proposed design, provide a cancer patient point of view regarding the eligibility of criteria, frequency of invasive testing, costs, logistical requirements, and patient feelings when deciding whether to participate or not. Help define how the patient experience will be monitored, developing or evaluating patient-reported outcomes or questionnaires, or identifying topics for personal interviews. Importantly, review the language used in informed consent and in informed and consent forms, and advocating to help maximize readability, sensitivity to patients' concerns and needs. Review an informed consent process to assure patients that have the ample opportunities to discuss and truly understand the nature of research and what is expected from them. So thank you so much for your time. I appreciate the opportunities to speak today, and I'm available for any further questions. Thank you.
Thank you so much, Dr. Byer. That was fabulous, and I love the new the new term that you've coined with us.
It just came to me as I was speaking it.
That's lovely. Let's start. Are we gonna turn all the panelists, all cameras should be? Yes. We have all the panelists. This was wonderful, and I don't see any questions from the audience, so I'm going to start with a few, but if anybody in the audience has something they'd like to raise, please pop it into the Q&A, and that's where I'll be able to find the questions. One of the things I was just thinking about, which is actually a combination of something from Amy and Dr. Leader and Dr. Byer. Just wondering, you mentioned talking about linguistics and changing how clinical trials are presented. And as Dr. Leader was saying, there is a lot of mistrust that kind of started to come back. And now I think we're in another session where we're probably dipping a little bit more, unfortunately. But I'm wondering too, discussing the initial trial is great. Is there a way to think about quantifying the effect of having an advocate's voice to make those patient-centered materials to see, what that improvement is?
I can start with that question. If I quantifying the effect of the patient voice on trials, correct?
Yes.
Yeah, I mean, I think there's a couple ways you could do it. I mean, the easiest one would be to think about uptake of trial enrollment, right? If it's more patient-centered and the patient feels that this trial is a match for them, then there's enrollment. But I think you could do some more in-depth understanding and maybe even some qualitative methods of whether the patients felt that these trials were for them, whether they were described in a way that is like them, that people like them would participate in them. And I think you could probably tease that out a little bit.
I think it would be really great to, have Dr. Byer, your advocate, participating in that and to see actually results of something, the impacts that the advocates had on research in general.
Well, yes, it was interesting to help write or, help with grants writing. The idea of making it more accessible and understandable for a larger audience that has been linguistically humility and cultural, trying to get that understanding and how people can better understand and then participate afterwards and feel comfortable participating in and then the clinical trial afterwards. Especially if I think sometimes it's better if they hear it from a patient research advocate, because they may, with of course the knowledge of the scientist, and then seeing that the results of in my particular situation working with the Keytruda, and it was interesting to see the reaction of the patients that could participate more in other research trials.
It's wonderful. right, we have a question for Dr. Bitar. Can you tell us more about the role of clinical trial equity navigator and what the activities are specific to that role?
So the clinical trial equity or diversity in clinical trial is very important nowadays because historically we have our clinical trials like certain groups of people, 80%, 90% is from the certain group of patients. So now we are working on improving the equity or even diversity in clinical trials. So it's still a lot of things to do for that. So we have like navigators and patient advocates with their who has good understanding of the specific the cultural barriers or their own languages, so they can talk to. Actually, they work between physicians and our patients, like very good bridge to explain about clinical trial with their own terms, and then to improve their understanding of clinical trials. So at my institution in Cedars-Sinai, we have like the clinical trial navigators and patient advocate in the different backgrounds. So we improved a lot of the enrollment of all the different background and underrepresented patient population in our clinical trials.
Awesome. There's a question here that just talks about measuring the impact of clinical trial navigation program, since not all patients we engage will be eligible for a trial. So that was kind of along the lines that we were discussing. Anything else to add to that one?
I can also comment. There's a great comment from our PCORI friends here. Thank you so much for your note. But also, I wanted to direct people to the PCORI website where they have methods and measures around patient and investigator engagement that people might want to look at. They have a really nice collection and papers that are published around perceptions of engagement, methods of engagement. Not only advocate preparedness, but also investigator preparedness, because this goes both ways. You have to have preparedness on both sides in order to have a meaningful relationship. So really appreciate the metrics question. And there's been a few validated measures in this field, and there's some really nice papers on the PCORI website as well. So thank you, PCORI, for joining us.
And then there's another navigator question, which just moved on me. How have you sustained the ability to perform the roles for navigators? And do you have continuous training, and is there organizational support, dedicated FTE? How does it work at your institution? Maybe Dr. Bitar?
Yeah, so I showed some our program Cedars-Sinai has. We have like specific like training sessions for our own navigators. So we have our own navigators in Cedars-Sinai Cancer Center. So we have some lectures and some courses, and they have like a very good understanding in both physician sides and then the patient side. And also we train the navigator in our community, mainly from the community clinics, and then our program is like church-based navigators, so they kind of know some details of the screening programs when they get the screening, and they have some symptoms, and they can recommend like some regular programs for our community.
And then Dr. Byer, this one is for you. I know that in part of your program, maybe you can speak a little bit. Somebody's asking about training for research or patient advocates, and how do you empower advocates to share their voice and connect their community with research?
So I have the pleasure to work with Pivot, and Pivot provides the training. In fact, when you become, active member part of Pivot, you have to take the training first, so that then you can participate in the active patient research advocacy. So
Maybe say what that is.
Every month we have meetings. We have workshops, we have trainings, we have, online training, you name it. And then there's a specific coordinator of Pivot, and I thank Tanya for that. And Hope Krebel is our director. They have they put in contact. There is a researcher, and they ask Pivot members if want to join and participate in that research.
And can you just talk a little bit about the training that you received? What was it like?
It is a self-paced training that we have designed, and it just goes through all the different modules. It's kind of like a self-contained course, and then you don't have a final exam at the end, but you have a little test that you can answer to see if you grasp the knowledge of that. So it's actually nice and interactive.
And are the modules related to trials, to grants? Do you feel that
they cover pretty much everything? Yes, you just name it. How from professionalism with the researchers and to being an active voice and giving the presentations and how to handle different dynamics, grants or just talking to the researchers and understanding, if that makes sense.
Great. And there's a question that's sort of in that similar vein, but I'm going to give this one to Amy. So it's asking how you could advise or train physicians to effectively communicate with the communities that we work with to foster that bidirectional communication.
Yeah, sure. And I'll go back one question really quickly before about the infrastructure needed to host such a program. And you're hearing folks from Dr. Bitar, from Silvia, the workshops and the trainings and the coordinator of the meetings. And so I think in order to do this well and meaningful within an organization, you do need some dedicated staff and some dedicated funding, and whether your navigators or community members are being compensated for this work. And so I think, sometimes I hear like, oh, we just added a community member to this panel. And I'm thinking there's a lot of preparation that happens on both sides in order to make it very meaningful. So it definitely requires an investment. And then speaking about the investigator side, we do some brief trainings. You have to be mindful of time. Investigators are very busy and they're well-intentioned and they want to have community members and patient advocates working with them, but they're also in a very busy schedule. So, we will engage them in trainings and meetings, but we'll also share slides with them. We'll share links with them. We'll share things that they can do in their other time. We'll often engage a lab member maybe who's not so senior as the PI, but someone has a little bit more time to engage with the community member. We might help them develop lay abstracts. We might, I think our team has provided a little dictionary of terms. Instead of saying benign, say not cancer. And so little things along the way that we can help them be ready to work with their community member.
Can I add one thing? So
Yeah,
actually,
please.
as physician, I learned a lot from our community. So I kind of trained myself while talking to our community members. So I have like regular meeting and lectures with the community and survival program. And while I'm talking to them, I can kind of learn what language they're using, what's their questions, what terms they want to listen. So I kind of modify my conversation based on my previous experience with the community.
And that's going to be different between physician scientists and other bench researchers, right? And how to interact and host advocates and get that voice too. So there's going to be some differences there. There were a few people with comments that I think are great. I just wanted to mention. So someone actually said that the ACS has a line navigation training program, which is something that you can use, and it just needs to be supplemented with a clinical trials component, which can be added on. Somebody also said that the Pivot Workshop is open to researchers and potential advocates on April 5th. So thank you for that. Amy, a lot of people are asking for the PCORI webpage.
Which we added. Both I did
Oh,
and
you
the
added,
Victoria
you added.
folks. So
Okay.
it's in there twice.
Okay, awesome. Sorry.
No, you're all
I
good.
didn't scroll down far enough. Let's see. Is there anything
Yeah.
else that I missed? Are there research subject? Oh, okay. Here's one asking, are the research subject advocates assigned per project or departments, or is it an institutional position? And if it's institutional, is the phone number for the RSA on the ICF? And does the role take care of these calls? That's a lot of acronyms here. Um, so I think most institutions, I guess, Dr. Bitar, do you want to say how the advocates, are they in your departments, or is there a pool that you can gather expertise?
Yeah, so our advocates, we have our own department advocates or the patient advocates. So they can be our old patients, or they have personal experience of the breast cancer, because I'm breast oncologist. So yeah, there are different type of patient advocates. And the community size, they're not really involved in any specific institution or some places. We just they work for the community as a patient advocates.
And Dr. Byer, do you want to just weigh in for you how that works? Are you pulled into things? Do you work with one researcher? How does that work?
I have worked with one specific researcher, and he is a oncoradiologist, and it was also interesting because then I was part of that original research, so I'm a little speck somewhere in one of the charts, and I'm glad to be there and here. So, but yeah, we do have pivot like workshop coming up, for instance, on April 5th. And as Tanya Yelder also put in the chat, and there's going to be a great, collaboration and discussion on what it means to be an advocate and how to engage others to become part of Pivot. And yeah, what is basically, we're going to train them to, just have their elevator speech. I did really try also to work with a local politician, elected officials, and Pivot has allowed this, and they have really facilitated that, because
Great.
there's a few things that it would be nice to be able to change at the state capital of Kansas.
Absolutely.
So yeah, things like that. Yeah.
Very good. Amy, there's a question asking about how advocates are recruited.
Oh, sure. There's no doubt that cancer patients and survivors have a really strong connection to this work and are a very natural fit. But also, I think casting a wider net into the community of people you may not know, you will find people who are very interested in cancer research for all sorts of reasons. And so we often work with our community advisory board to get the word out, community partners. I really believe in spreading the message far and wide, to find people that you might not have had on your radar. Of course, cancer patients, I think, and survivors will always sort of be at the heart of this. But a wide net is always good.
Absolutely. And then someone mentioned about with advocates, it's about building confidence as they are the expert of their experience and are asked to share their collective experience, right? And I think that goes along with the question about investigator training too. So if an investigator is working with an advocate, it's a pause, right? Ask the advocate directly for their input. And empower them to do so. So that's, I think, going on the side of the investigator training too. All right. So is there anything else that we can do real quickly? Because we're almost at the hour. There are some great links in there. So if you want to take a second real quick to click the links for the Pivot program, there's a registration there if anyone wants to join the training for April 5th. And then the PCORI websites. But with that, I want to thank all the speakers for taking the time today. I think this was really valuable as we all think about the research and partnering with our COE at our cancer centers. It's really important to think about the process and think about all the different perspectives that are involved that we just talked about. So thank you to everyone. Dr. Byer, special thanks to you for taking the time. It's really important to have
Thank you
had
for having me. It was a
Yeah.
wonderful experience.
Oh, great. Thank you. All right, everyone. Thank you so much.